For my service project, I shadowed a doctor for a day. I got to experience various medical procedures such as x-rays, small surgeries, and even got to hang out in the lab to watch people get their blood drawn. Through this experience, I learned more about problem solving and interacting with patients. More importantly, this experience taught me more about the seriousness of heart disease. My grandfather recently had a heart attack, and seeing patients who suffered from the same disease was tough. Heart attacks occur when the heart cannot get enough blood, which is caused by plaque buildup in the arteries.
A heart attack is basically a blocked blood flow to the heart. Now, it's like the plumbing system to your house. If it is blocked, you can't get water. The same way, if the arteries to the heart are blocked, the heart muscle hurts, and that's what causes the chest pain that brings people's attention to the doctor. And there are two main coronary arteries that supply blood flow to the heart. That's the right coronary artery and the left main coronary arteries, and this further branch out into different branches. Um, so blockage of these arteries is what causes a heart attack. That part of the muscle dies, and it will not recover. But if you don't treat on time, these patients die mostly of malignant arrhythmias. The heart goes into a different rhythm called ventricular tachycardia, ventricular fibrillation, and then the heart cannot supply enough blood flow to the brain and it stops. And of course, there are various complications of which they can die, including heart failure, a ventricle can burst called ventricular aneurysms, ventricular rupture, etc., etc. There is various complications that can happen because of a heart attack or a blocked blood flow to the heart.
Make sure to donate to the American Heart Association to help fund patient support and also research for heart disease.